Hi Jackie, thanks for joining me today. Just perhaps you could start by telling us exactly what it is that you do at First Psychology.
Sure. I work as a counseling psychologist at First Psychology. It will be 3 years in August. I've qualified in 3 years in May. And as a counseling psychologist, the way I kind of explain it to my clients is I'm trained in various therapeutic interventions, some kind of non-directive like person-centered therapy, and then some more directive like CBT.
Okay.
And I wouldn't really consider myself classically any one in particular.
Okay.
I'm not kind of classic CBT but I would say my roots are in person-centered therapy.
Right, okay.
And then I, as needed, when I kind of see an opportunity or think a tool from various other interventions might be helpful, I kind of use that in that moment. And yeah, so that's kind of how I explain it to my clients, that I kind of use various interventions. I'm really liking the third wave CBT interventions, mindfulness and compassion focused therapy and DBT. I took a course on that last year, and I really appreciated some of the tools that I learned in that. So yeah.
So does it just depend on the individual?
Yeah, absolutely. And yes, I always tell clients, if I'm working in a way that's not helpful for you, or you would prefer more direction, then I would be willing to try to adapt my practice as much as I can.
Absolutely. So how long have you been with First Psychology? Is that since you?
It was kind of I did my Viva, and Ewan was on my Viva panel, and I really enjoyed my Viva. It's kind of the thing that everyone fears for the full 3 years of the program. And I had my Viva, and it was actually a really enjoyable experience. And then so I just emailed Ewan after my Viva just saying, thanks for such a great experience. I actually surprisingly enjoyed it. It was more of a really kind of like intellectual academic conversation. I felt like it was quite nice. And so I just said thanks for such a great experience on the course and for the Viva, and I was like, if you think I would be well suited for any of your offices, I would love if you would consider me. And he called me in for an interview, and I was being interviewed by Maria shortly after, and then started in the Glasgow office in August. I guess that would be 2014, and then started in the Edinburgh office in October 2014.
Right.
And I've been here ever since. Yeah, it's great.
And when did you first decide this was the career you wanted? How did you first become interested in being a counselling psychologist?
It's kind of funny how I ended up in psychology. It wasn't my plan at all. I started my undergrad in political science with a plan of becoming a lawyer, which is so unlike me. My parents were a little like, really? That does not sound like you at all. So I was doing political science, hating it, so bored. And in Canada, undergrad degrees are quite different. You do kind of electives as well, so you kind of round out your degree a bit more, whereas I understand in the UK, undergrads are very much, you are doing this course and you are kind of just studying that. Whereas in Canada, you have to do a language, you have to do, if you're in arts, you have to do a science. So it's quite nice. You end up doing a whole bunch of different things. And so I took a psychology elective, and I loved it. I absolutely loved it. I took away more from that year-long course than I was taking away from any of my political science courses. So then I changed my major and changed over to psychology, which actually required me changing universities as well, which was another story. But so just loved psychology. And then I didn't really have plans of doing a post-grad degree. I wanted to be a psychologist, I definitely did, but I was kind of done with uni, done with studying, just kind of wanted to just get to work. And I did that for 2 years, and then got pretty bored pretty quickly, just working at 9 to 5 office, and kind of figured I either stick this out and do this forever and kind of climb the corporate ladder, which is not me either, or I go back and do a postgrad degree. And then I was looking at master's programs in England and Australia, and a girl that I worked with was from Airdrie, and she told me about the counseling psychology program at Cali, and she was like, you should look into it, like you're you're applying in England, why not check this one out? And so I did, and I was like, I didn't even know what counseling psychology was. And then so I started reading up about kind of the Canadian guidelines and their explanation of counseling psychology and the difference between that and clinical. And it totally resonated. It just felt really natural to me that I can't imagine myself being really clinical, and kind of, that's just not my nature. And so, so I was like, it sounds exactly like what I want to do. And even though I wasn't really I wasn't looking to go back to school, I wasn't really looking to do another 3 years, but I knew if I got on, I was like, I remember telling my mom, I was like, there's no way I could, if I get accepted, I could never turn down that offer. So I got accepted, and I was, here I am.
Yeah. Great. So what kind of qualifications and experience overall were needed to get this role?
So I had to do the psychology undergrad. So even though I switched majors, I still have enough credits that I have kind of technically, because I did 2 years in political science and then switched to psychology, I have a degree in psychology and then a minor in political science, just because I have so many political science credits. So undergrad in psychology, and then the doctorate course in counseling psychology, and then I've done other things as well. I have the BPS supervision certification, but you basically need the undergrad and the doctorate.
Okay. And how many clients do you see in a typical week?
I have 24 slots, so 6 slots a day from Monday to Thursday. And I would say on average, I probably see about 21, 22 clients a week. It's pretty full on, but it is. But I like it. It's really good. Sometimes I really try, when I first started, I would think I was doing a bit too much of kind of adding appointments in my diary or booking clients during my break and seeing like 8 in a day, and it's just too much. I just find I can't connect as well. I'm just exhausted. So I really have learned to really keep those boundaries and just stick with 6. And that being said, I'm totally overbooked this week.
Better than 8. Okay, and what would you say you find most rewarding about being a counselling psychologist?
Just seeing the impact it has on people. It's such a rewarding experience. I work with a lot of young people right now, and just seeing these little kids come in, it's just like, it just breaks your heart when you see a young person struggling, and whether it's bullying or anxiety, and then when you see them improving, it's just the best feeling. It's so rewarding. It is a really great feeling.
So this might be a bit more difficult question, but what would you find more challenging about your role?
I think that sometimes as practitioners, I think that sometimes clients don't realize how we are in the relationship as well. And when clients kind of disappear or just don't show up, or it's kind of like, well, I've committed to you. Why are you not, like, you asked to come see me, and you're just like, other people would use this appointment and you're just not showing up, or I think that's always hard. I've spoken about that with other practitioners, that when it doesn't feel like we're being considered in the relationship. I know that is a lot to ask for clients, because they're obviously going through a lot, but we're invested in it too, and it's hard to not be.
And to not know why. And is being a counselling psychologist what you expected? Or is there anything that surprised you along the way?
I think I thought when I first found out about counseling psychology that it would be more less, what's the word I'm looking for? Like, the cases would be less severe, or that kind of the more intense cases would be just for clinical psychology. But it is quite nice seeing how, we can see a whole array of populations and people with any kind of symptoms or displaying various disorders. And so, I think that it doesn't need to be, you have to see clinical or you have to see counseling psychologists, that we can kind of see really whoever. And it is it's just about the relationship. As long as they're connecting with that client, then that's what will probably help.
Yeah, that's quite a nice surprise then.
Yeah, definitely.
And do you have any areas of expertise or specific interest yourself?
When I was training, I kind of fell into complex trauma, mostly because I was doing a lot of work with survivors of sexual abuse.
Mm-hmm.
So I worked at Open Secret for a lot of my training, and so I did a lot of work with complex trauma, PTSD, with adults, and that was really interesting. And so I would say, when people ask me, like, what did I specialize in, or did I specialize, and I in counseling psychology, you don't really specialize like you would in clinical, but that's probably what I would say, just the way my placements lined up, that's where I did most of my work.
Yeah. And how do you keep up to date with all the latest research in the different areas of psychology?
Yeah, I'm subscribed to a few journals. I have the BPS, I'm a member there and have their journals, and read the psychologist and keep up to date with those things. I've done a few CPD certifications. I did the BPS supervisor course. I did the third wave CBT course. That was really interesting. I'm really glad I did that. So I haven't signed up for anything as of yet. I really wanted to do the program that First Psychology is offering, but all the days the ones that I wanted to go to, I'm working on those days, and so it was hard to not to try to find time for that. But I'm always kind of keeping an eye out. I'm getting emails constantly about BPS training courses. So I definitely need to do one this year. I kind of like to do one every year. Supervision was the first one. The third wave CBT was last year, and then this year I've been keeping my eye out on what I want to do next. Yeah.
So always something new then.
Yeah. I think it's so important to stay up to date and informed.
Because quite a lot of things are changing. Things are always being discovered. And treatments and stuff.
Exactly.
So it's important.
Yeah.
And are there any other areas of psychology that you'd like to explore in the future? Anything specific, or
as far as new training, or
anything that's in your mind?
I think what I would love to do is do like an EMDR course and a full DBT course. That even though I did the third wave CBT certificate, I'm by no means a DBT practitioner. I use skills, but I would love to do like the full course. Yeah.
And do you have any helpful tips or advice for students like myself or other people interested in this line of work? I would say it's a commitment. It's hard work, but it's so worth it. It's so rewarding. It's not a typical job. I had the whole office job thing, and I'm so glad I got out of that. It's just such a great way to spend your career, just kind of with people and helping people, and so if you're interested in it, for any students that are interested in it, I would say it's a commitment, but it's worth it. Great. That's good. That's positive. Well, that's all my questions today. That was really interesting talking to you, Jackie. So thank you so much for meeting with me today.
No, thanks for asking.